Well, good evening. Good evening. Welcome to the Doctor's Edition. This is Dr. Rita McGuire, the Chief Medical Officer and one of the co-founders of Wakana for Life. And we're going to get started with our presentation this evening. I want to first introduce also our Medical Advisory Board. Our Medical Advisory Board is made up of healthcare professionals that are advocates for our CBD products here at Wakana. It's made up of medical doctors, MDs, NDs, naturopathic physicians as well, RNs, LPNs, CNAs, therapists, clinical psychologists, dentists, pharmacists, and even chiropractors. So we have such an amazing group here of healthcare professionals, and want to thank all of them for all that they do and all that they pour into these calls and our conferences. A little bit about myself. I'm an obstetrician gynecologist of over 30 years. I trained at Wayne State School of Medicine. I completed my residency at Cook County. I'm the CEO of RJM Wellness and RITA Fitness. I'm a global women's health and wellness speaker, and also one of the certifying physicians for medical marijuana here in Illinois, as well as I was the very first physician to certify a patient in our opioid exchange program. I'm a member of Doctors for Cannabis Regulation, as well as one of the 4 co-founders and chief medical officer for Wakana for Life. So this presentation is for healthcare professionals, for doctors and nurses, because something they did not teach us in medical school, along with nutrition, was cannabis and the endocannabinoid system, which you're going to learn about tonight. And that really explains how cannabis works in our body. It's probably the most vital regulatory system that exists in our body. And I think that every healthcare professional should understand how cannabis works. So Dr. Sanjay Gupta, we all know our colleague, but what you may not know is that in 2009, he said no to cannabis. In fact, in 2014, 2015, he had to come back and make a public apology and said that we have been systematically misled about this plant, that as a physician, he didn't dig deep enough, he didn't look in the research enough, he didn't talk to enough experts, and he didn't interview enough patients that were utilizing cannabis byproducts and cannabis products for their health. And so Dr. Sanjay Gupta has absolutely made cannabis mainstream when he made those comments in 2014, 2015. So let's look at the plant. You know, many of healthcare professionals, we know about marijuana or weed or reefer, getting high, right? Our patients, I know my patients as an obstetrician gynecologist, 99.9% of the patients that come into the inner city hospital that I work at, 99.9% are positive for THC. So they're using cannabis for their nausea, their vomiting, their anxiety, their insomnia. But tonight we're going to learn about a part of the cannabis plant that doesn't give you the high, doesn't give our patients the high, it doesn't give them the euphoria, paranoia, or even the munchies, and it's hemp. It's on the left side of the screen. It, by definition, contains less than 0.3% or less of THC. Whereas on the other side, the marijuana side has large upwards of 10 to 20% of THC or Delta 9. And this is why marijuana gives our patients the high, the euphoria, the paranoia, the psychotropic side effects because of the Delta 9 that is so high in marijuana. Now, both products, both species have been found to be very effective medicinally. Another addition that is very unique to hemp is that there are many industrial uses. So we are now seeing homes being made out of hemp. We're seeing clothes and shoes. In fact, if you look back, the very first Bible was constructed on paper that was from hemp. And the very first Model T Ford was constructed from hemp, and it ran on gasoline that was from the hemp plant. So many usage of this plant over thousands of decades. But tonight we're going to concentrate on the hemp species, as it is legal in all 50 states, and it won't give our patients a high. We'll even talk about some products that are safe in those who have random drug screens at their job. So the big takeaway tonight for healthcare professionals is the difference between marijuana and hemp. One being marijuana on the right gives you a high, gives you euphoria, paranoia, because it has high levels of THC, whereas on the left, hemp has 0.3% or less of THC, so low that there are no psychotropic side effects, there's no high, there's no euphoria, there is no paranoia. Now, phenotypically, the plant is very different, its characteristics, when we look at the different species, the hemp versus marijuana. If you go to a farm, you'll see that the hemp plant grows very tall, it's very lean, whereas the marijuana plant is shorter. It resembles a bush, and the leaves and buds are more closer to the body of the plant. And yes, when we talk about legality of the cannabis plant, well, the hemp species is legal. In fact, in 2018, when the Farm Bill was passed, it removed hemp from being a Schedule I drug. So for decades, right, this part of the cannabis plant, which doesn't give you a high, which has very low levels of THC, was categorized just like a Schedule I drug, just like LSD and just like cocaine and those other harmful drugs. So in all 50 states, CBD is legal if it's sourced from the hemp species and contains 0.3% or less of THC. So the only FDA approved CBD prescription that I want you to be aware of is Epidiolex. Epidiolex is a medication that's approved for children that have seizure disorders that are associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex. The unfortunate thing about Epidiolex is that it's about $3,200 to $3,500 a month, and most insurance companies do not cover Epidiolex. Now, there are some other FDA-approved medications that a lot of oncologists are using on their patients. If they don't know about CBD, these are medications that are from the THC or marijuana plant. So these medications we're going to talk about will give the patient a high. One is Syndros. Dorabenol is used to treat nausea and vomiting caused by cancer treatments. That's why those oncologists, like my aunt's oncologist at the University of Chicago, really promote CBD. And she used CBD for her nausea and vomiting as she was undergoing chemotherapy for her uterine cancer. This medication is also used to increase appetite in AIDS patients. Marinol is another medication, as well as Sesimex. And Sativex is not FDA approved in the US, it is in the UK, but it is a 1-to-1, meaning there is a hybrid of Delta-9 and CBD. So this is why it's so important that as a healthcare professional, you understand more about CBD, right? Because even though a patient may have cancer and may have intractable nausea and vomiting, they still, for the most part, don't want to be high. Even if they have debilitating pain due to metastasis of their cancer, if they could use a product that would give them the benefits medicinally without the high, they would choose CBD. And that's why it's important that you understand more about CBD or cannabidiol. So, our patients are sick and tired of all the medications they're taking, all the side effects. And again, CBD can be a tool in the medicine cabinet to either reduce or even remove a lot of the medications our patients are on. So what are some of the top reasons our patients are using or looking to use CBD? Well, you can see here relaxation, stress reduction, improvement of sleep are the top three, right? And right next to that is pain, relieving chronic pain, relieving acute pain, muscle and joint pain, and then to have some social uses of CBD. That's a number 22%, as well as skincare, sexual enhancement. Now that CBD is mainstream, folks are understanding that they can use it for a host of their concerns and challenges in their health. When we look at the age demographic and even regional, we see that baby boomers are increasing use, as well as the millennials. Millennials, now that they understand, hey, there's a product that I can use that won't make me high, it won't make me paranoid, and possibly I can still use certain products that won't even show up in my urine drug screen, because so many people are still getting random drug screens as well. So let's take a deep dive with CBD or cannabidiol. The plant has over now really 140 compounds, we call them cannabinoids, that have been identified. In this slide, you can see some of the major cannabinoids, but CBD or cannabidiol is the number one. It has more medicinal benefits than any of the other cannabinoids that the plant can produce. Antibacterial, it inhibits cancer cell growth. It promotes blood sugar levels. It reduces inflammation and pain. It helps to relax and to reduce anxiety. And even it can help to suppress muscle spasms. So when we look at the benefits that CBD has, in fact, there's over 20,000 peer-reviewed articles. And now that hemp is legal in all 50 states, we're seeing large teaching institutions like UC San Diego doing now studies on humans, looking at the therapeutic effect or therapeutic potential in a lot of disorders like ADHD and lupus and eating disorders and so many more. So CBD, yes, is it Shiro? I'm going to call CBD is she, right? But there are also cannabinoids like CBG and CBC and delta-8 THC, delta-9 THC, and THCV that will promote healing, will promote wellness in the body, just like CBD. So the synergy of putting all of them together is what's so magical when we are really helping our patients to reduce pain, anxiety, or to help them sleep, or to help to reduce muscle spasms. Whatever it is, there is some cannabinoid that's directly targeting that issue, or the synergy of all of the cannabinoids can target that issue. Well, the great thing is that not only does the plant produce cannabinoids called phytocannabinoids, but the body does too. Yes, our body can endogenously, internally produce chemicals that are very similar to what the plant's producing. And two of the top endogenous cannabinoids that our body produces is anandamide and 2-AG. Well, anandamide is analogous to delta-9 THC. it really gives us the bliss. In fact, it comes from a Sanskrit word, ananda, meaning bliss, meaning joy, meaning happiness, right? And then 2-AG is analogous to CBD. It really helps the body to relax, the body to really get into a state where there's reduction in inflammation and pain in the peripheral and even the immune side of the body. So the way that cannabis works as a whole, when we are talking about hemp or marijuana, is through a very vital regulatory system called the human endocannabinoid system. This system is made up of receptors. The system is made up of enzymes, and these main receptors are in the brain, the central nervous system, the immune system, and the periphery. There's other glands and organs that have these major receptors, like our heart, our lungs, our skin, our kidney, our liver, our teeth. All of these receptors, when you consume CBD, you consume cannabis, helps to put the body in balance. It helps to promote homeostasis. So for instance, if we have a patient that has pretty bad gout and has a gout flare and is looking for a product that is going to reduce that inflammation and pain without having possible end organ damage to the kidneys and liver because of medication side effects, well, CBD would be a great tool to reduce inflammation, to help to reduce that pain in a holistic, natural way. So the human endocannabinoid system wasn't taught to us in medical school or dental school or whatever profession you're in, but just know that this system is a major player in regulating so many pathways in our body to bring balance. There's also the importance of knowing that CBD can interact with some of our patients' medications. CBD, cannabidiol, is metabolized in the liver through the CYP450 pathway. Many drugs are metabolized in the liver. Two main drugs are Coumadin or warfarin, and theophylline. Now, these two drugs need to be monitored just a little bit more closely. INR is checked a little bit more frequently, theophylline levels, but just know that CBD can interact and inhibit the medications our patients may be on, or it can potentiate some of the medications that our patients are on. So making sure our patients are using CBD about an hour or two after their prescribed medications, and then as practitioners, checking those levels a little closer. Does CBD show up in a drug test? Now, I alluded to a little earlier how there are products that patients can use safely if they have random drug screens at their job. Well, there's one thing that you need to know, or maybe two things, is that any product that is a topical CBD product that contains the legal limit of THC in that product, which is 0.3% or less, can be safely used in your patient without having an issue and failing a drug screen. Another thing is that when you use topical CBD, it doesn't pass the blood-brain barrier, and that's why it's safe. There are some studies that show that even at large, we're talking about large doses, like 1,000 to 2,000 milligrams of CBD a day, there is an 11 to 23% chance of that CBD, that full spectrum product, being detected in a drug screen. So we would really want to avoid, right, our patients losing their jobs. So there are products like isolates, which are just CBD, and then there's broad spectrum products that contain less than 0.0% of THC that can safely be used along with the topicals in our patients that have random drug screens. So really, really push the issue on your patients that their employer used LabCorp. LabCorp has a urine drug screen that's very sensitive and very specific. A lot of these point of care tests that you're getting at Walgreens are not very specific or sensitive, and they don't know the difference between CBD and THC, right? It's just a cheap over-the-counter drug screen. So really, really advocate that your patients, if they have to undergo a random drug screen, that their employer send them to LabCorp for that to be done. So there's 5 things to know before buying a hemp-derived CBD oil product, and that is to buy all of your products from Wakana, making sure your patients are purchasing our products. Why? Well, our products are compliant under the 2018 Farm Bill, meaning that our products are sourced from hemp that contain the legal limit of THC, which is 0.3% or less. Our CBD oil is extracted in a very clean and safe way from the biomass through a CO2, supercritical CO2 extraction method. And that's important, right? We don't use butane or propane. And all of our products come with a certificate of analysis. All of our products are tested to ensure there's no mold, mildew, heavy metals, pesticides, or residual solvents in the products that can harm your patients. So what's inside really does matter most, and it should match what's on the label as well as the certificate of analysis. So that's a supercritical CO2 method. It's the cleanest method. It is a little bit more expensive, but cleaner than butane and propane. And then there's different ways that your patient can use CBD. They can have an oral applicator, which is a tincture. They place the oil under their tongue, or they can vape it. They can smoke CBD. They can put their CBD in their water, their juice, their tea. That's a water soluble or a liquid form. There are edibles, there are gummies, there's spices, there's butters, there's ways that you can still get the same benefits, but in a gummy, right? There are capsules, and then there's topicals. So if you want to know what is the best way to consume CBD, well, the best way to consume CBD for 99% of our patients is to layer the CBD. That is to use in your patients the tincture under the tongue, the gummies, as well as the topicals. And for all of those patients who have acute conditions, like they have gout, so they can have an acute onset of gout, or if they have migraines, they can have an acute onset of migraines, or lupus, they can have an acute lupus flare. All of those categories of patients really, really need to have a smokable on hand as well. The smokable products work within 1 to 5 minutes, so they're fast acting. The tinctures take about 15 to 20 minutes to get into the bloodstream. The gummies, the edibles take about 30 all the way up to 2 hours to get into the bloodstream. The topicals are pretty effective immediately, and the capsules, of course, are like the edibles. They've got to go through the stomach, the liver, before they can get to the bloodstream. So they're going to take a little longer as well. So when we are recommending CBD, what kind of CBD products to our patients with diabetes, heart disease, hypertension, these chronic long-term comorbidities, you still want to start low and go slow. You never want to introduce a lot of CBD very quickly just because someone has a long-term comorbidity that's been chronic, right? Start low, go slow, 3 drops twice a day is what we recommend. That will give you around 10 milligrams of CBD. When we talk about CBD, we never give the assumption to our patients that this is going to cure their diabetes, or this is going to cure their hypertension, or this is going to cure their gout or lupus or fibromyalgia. But what we can say is that this will assist with the symptoms of diabetes, the symptoms of lupus, the symptoms of fibromyalgia, the symptoms of gout. So the symptoms in every chronic long-term condition, or maybe even acute condition, can be addressed with CBD safely. Even cholesterol, we talk about a lot of the symptoms that those may have with high cholesterol, but start low and go slow. The studies that you want to review on CBD, cannabidiol, cannabinoids in general, is through PubMed. You want to look at all of the data, all of the research on many, many, many disorders that our patients have. You can find that in PubMed. So let's look at some of our products. Again, the FDA disclaimer that the statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute for or alternative to information from healthcare professionals or practitioners. Please consult your healthcare professional about potential interactions or other possible complications before using any product. The Federal Food, Drug, and Cosmetic Act requires this notice. So our certificates of analysis is our third-party testing. We partnered with Green Scientific in Davies, Florida, and these certificates are found on all of our products to ensure that the proper potency is there, the percentage of THC is the legal level, 0.3% or less, and that our products are free from mold, mildew, heavy metals, residual solvents, and pesticides. So our tinctures include our Power line, which is our full spectrum line, the legal limit of THC, and our Pure line, which is our broad spectrum line. That has less than 0.0% of THC. So the Pure line is for those patients who have random drug screens, and the Power line are for those who do not have random drug screens at their job. Our Hempranium 500 milligrams is our #1 top selling tincture, 3 drops under the tongue twice a day. Make sure your patient holds it under the tongue for 60 seconds before they swallow so that it's really being absorbed in the sublingual glands. Our water soluble is a great product to add to water, juice, tea. Even for those cognitive challenged patients with dementia, it's easy just to add this in their water, their juice, and keep it moving. Our Hemp MD is our more therapeutic and potent CBD tincture. Instead of the 500 milligrams, it's 900 milligrams of CBD. Love using this product for that patient that has more challenging conditions going on. Our Empowered Hair is another tincture, or you can use it topically. We know that hair loss, alopecia, female male balding is a huge issue, right? We've got hormonal reasons why folks are losing their hair. We got COVID infections, why folks are losing their hair, and then we have traction alopecia. Folks are losing their hair because of the hairstyles that they are choosing to wear. Our topicals offer local relief pretty quickly. Our Extreme Pain Cream is our #1 topical seller, 400 milligrams, along with 8 essential oils that help to reduce inflammation and pain. Another favorite is the Dr. Rita's Rub. It's a roller ball, so you can just easily roll that on. It's a liquid form. Our Power Mango Body Cream is a great body cream for the entire body. And our Holy Glow is a great facial serum that really addresses anti-aging as well as other skin challenges. Our edibles include our gummies, our flat belly brew. We have a CBD infused coffee to help get that belly flat. We also have flat belly gummies to help get that belly fat flat. We have Delta 8 gummies, our Flight 50 and our Flight 25. Delta 8 is a relatively new cannabinoid on the block. Millennials love it because it increases their creativity. We have a sexual enhancement gummy, King of the Jungle, for both men and women. And we also have our full spectrum as well as our broad spectrum gummies for those who have random drug screens at their job. Our essential oils, when I tell you I love our peppermint, I use peppermint like people drink Red Bull, right? Peppermint gives me energy, so I put it on the soles of my feet in the morning. Midday, if I need more energy, I'll rub it in the palms of my hand, and I just inhale the peppermint. We also have our First Defense, which is really, really a top seller during this global pandemic. We've combined CBD with essential oils to really address bacterial and viral loads that can enter through our nasal passageway. Our smokables, like I said earlier, are fast acting. You want to have a smokable on hand if you have challenges in your life that sometimes has an acute flare or an acute presentation like a migraine, right? So 1 to 3 pulls is all you need. We have CBD joints, we have Delta 8 joints, we have our vape cartridges, we have flavored, non-flavored. I absolutely love our smokables. Our culinary department includes our garlic fire, our flavor king, our chili lime. These are great spices that are not coated with CBD, but infused with CBD. Our vegan butter, again, 300 milligrams of CBD. And our Culinary Plus is a great product you can bake and cook with CBD. Our Save Our Strands hair care system includes CBD infused shampoo, moisturizing conditioner, leave-in detangler, styling cream, beard and scalp oil, and then of course we talked about the hemp-powered hair if you need to use it internally, but you can use it topically as well with this hair care system. Our sanitation includes great products that can address COVID-19, keeping our home, our offices safe and clean and sanitized. We offer a hand and surface sanitizer. We have our produce wash, as well as we have hotel travel safety kits. Our sexual health, we talked about the King of the Jungle gummies. Many of our patients have issues with erectile dysfunction or poor libido or vaginal atrophy and dryness. So our CBD lube, even though it's a full spectrum topical product, will not pass the blood-brain barrier. So your ladies, patients, your female patients can safely use this if they have random drug screens to help to lubricate that area that is very dry during menopause and perimenopause. Our Seduction CBD body butter comes in lotus and hibiscus, is a great addition to our sexual health. And so there's so many great choices. Your patients can't go wrong. You can't go wrong recommending the crown jewel of CBD, which is our Wakana products. I want to thank you for attending. I've included my email address. It's ritamd@wakana.com. If you have any further questions or concerns, meet me in 30 minutes for our 8 o'clock business overview. That is the Zoom ID and passcode for more information about the opportunity that we have here at Wakana, our leadership, and our products. Have a good night, and we will see you very soon.